What is throat cancer? Cancer is a class of diseases in which abnormal cells multiply and divide uncontrollably in the body. These abnormal cells form malignant growths called tumors. Throat cancer refers to cancer of the voice box, the vocal cords, and other parts of the throat, such as the tonsils and oropharynx. Throat cancer is often grouped into two categories: pharyngeal cancer and laryngeal cancer. Throat cancer is relatively uncommon in comparison to other cancers. The National Cancer Institute estimates that of adults in the United States, about 1.2% will be diagnosed with oral cavity and pharyngeal cancer within their lifetime. About 0.3% will be diagnosed with laryngeal cancer within their lifetime. Types of throat cancer. Although all throat cancers involve the development and growth of abnormal cells, your doctor has to identify your specific type to determine the most effective treatment plan. The two primary types of throat cancer are squamous cell carcinoma. This type of throat cancer affects the flat cells lining the throat. It's the most common throat cancer in the United States. Adenocarcinoma. This type of throat cancer affects the glandular cells and is rare. Two categories of throat cancer are pharyngeal cancer. This cancer develops in the pharynx, which is the hollow tube that runs from behind your nose to the top of your windpipe. Pharyngeal cancers that develop in the neck and throat include nasopharynx cancer, upper part of the throat, oropharynx cancer, middle part of the throat, hypopharynx cancer, bottom part of the throat, laryngeal cancer. This cancer forms in the larynx, which is your voice box. Recognizing potential signs of throat cancer. It can be difficult to detect throat cancer in its early stages. Common signs and symptoms of throat cancer include change in your voice, trouble swallowing, dysphagia, weight loss, sore throat, constant need to clear your throat, persistent cough, may cough up blood, swollen lymph nodes in the neck, wheezing, ear pain, hoarseness. Make a doctor's appointment if you have any of these symptoms and they don't improve after 2 to 3 weeks. Causes and risk factors for throat cancer. Men are more likely to develop throat cancer than women. Certain lifestyle habits increase the risk of developing cancer of the throat, including smoking, excessive alcohol consumption, poor nutrition, exposure to asbestos, poor dental hygiene, genetic syndromes. Throat cancer is also associated with certain types of human papillomavirus infections, HPV. HPV is a sexually transmitted virus. HPV infection is a risk factor for certain oropharyngeal cancers, according to the Cancer Treatment Centers of America. Throat cancer has also been linked to other types of cancers. In fact, some people diagnosed with throat cancer are diagnosed with esophageal, lung, or bladder cancer at the same time. This may be because these cancers have some of the same risk factors. Preventing throat cancer. There's no definitive way to prevent throat cancer, but you can take steps to reduce your risk. Stop smoking. Use over-the-counter products such as nicotine replacement products to quit smoking, or talk to your doctor about prescription medications to help you quit. Maintain a healthy lifestyle. Eat plenty of fruits, vegetables, and lean meats. Reduce fat and sodium intake and take steps to lose excess weight. Engage in physical activity at least 2.5 hours a week. Reduce your risk of HPV. This virus has been linked to throat cancer. To protect yourself, practice safe sex. Also talk to your doctor about the benefits of the HPV vaccine. Diagnosis of throat cancer. Tests to diagnose pharyngeal or laryngeal cancer may include physical examination. Your doctor will examine your mouth, throat, and neck and may insert a gloved finger into your mouth to examine areas that are difficult to see. Blood test. Samples may be taken to check your general health. Biopsy. The doctor will remove a small sample of tissue or cells for examination under a microscope to see if cancer cells are present. Endoscopy of the larynx. A thin tube with a light on its end. Endoscope will be inserted through the nose to look for abnormalities in the throat. Ultrasound. A small device called a transducer is used to send out sound waves that echo when they hit something dense such as an organ or tumor. X-rays. You may have a chest X-ray to check your overall health or to see if cancer has spread to the lungs. CT scan. A CT, computerized tomography scan, uses X-ray beams to create detailed cross-sectional images of inside your body. MRI. An MRI, magnetic resonance imaging scan, uses magnet and radio waves to create detailed images of the inside of your body. PET scan. A PET, positron emission tomography scan combined with a CT scan, is often recommended. Radioactive material is injected into the body to help show cancer cells. After a diagnosis of throat cancer, After finding out you have throat cancer, you may experience a range of emotions such as disbelief, confusion and sadness, and feelings of loss of control. These reactions are normal, and you may find it helpful to talk to family and friends about how you feel. Talk to your doctor about treatments that are available to you, potential side effects, and how soon you should start treatment. Take as much time as you can before making a decision.